Hey y'all, hey, it's your girl Nurse T coming to you with another video. In this video, I wanted to go over some things that you might want to remember when giving a blood transfusion. So I know we get a lot of people who are new to nursing or just pretty much in nursing school that just want to know what are the steps. I'm getting ready to take this test and I need to remember pertinent information on what I need to know before giving a blood transfusion. So grab your pen and paper or whatever you need to jot down these important steps so that you can be successful when it's time for your next blood transfusion. Okay, y'all, surprise! Bailey has decided to join me on this blood transfusion vlog. Say hi, Bailey. Say hi. You gonna say hi? You just gonna look? Okay, y'all. So we're gonna start with number one. Number one is you're supposed to give a blood transfusion and you decide, okay, so you're supposed to give a blood transfusion. The first thing you want to do is you definitely want to make sure that there is an order for a blood transfusion. You never go about doing a blood transfusion if there is no order. If you come on shift and you see that you have a new order in the computer saying to give a blood transfusion, that's one thing. But if you come on shift and someone tell you, oh, such and such needs a blood transfusion today, so you definitely want to make sure that there is a consent. That there is an order for a blood transfusion. The next thing is you want to make sure that the patient has a typing screen. The typing screen lets the blood bank knows what the patient blood type is. Does the patient have any antibodies? So definitely collect that typing screen. The third thing you want to do is make sure you find out if the patient had any previous transfusion reactions. So usually with that, if they tell you they had a previous blood transfusion reaction, I like to call the doctor to make sure to see if they want to have some pre-medications on board. Usually like some Benadryl, some Tylenol. Sometimes they might run a little fever, they might start being itchy, whatever. Most of the time they'll order some type of a pre-medication for that. The next thing you want to do is make sure that you have the appropriate IV size. So blood is thick, so you definitely want to make sure that the patient either have a 20 or an 18. 20, 18, 16, whatever. Those are larger IV needles that you would need for blood transfusions. So typically we make sure they have either a 20 or an 18. The next thing and the most important thing that you definitely want to make sure this patient have to CYA, cover your is to make sure that the patient has a consent. Okay, make sure that the patient has a consent. If the patient is not able to sign the consent, call the POA, call the power of attorney to make sure that they are okay with the patient to receive the blood that's ordered. All right, so you go down, you make sure that the order is there, make sure the patient has the appropriate IV needle size, you make sure that the consent is there, and you verified if they've had a previous reaction and all that stuff. Now you're going to go down to the blood bank to retrieve the blood. At that time, you're going to go verify the blood with the blood bank representative, and then also when you come to the unit, you're going to verify with another nurse. Important, verify with another nurse. No unlicensed personnel, but with a registered nurse, you will verify that the blood typing, everything that's on the blood bag, you will verify with another registered nurse. Okay, so the next thing you want to do after that, you have the blood, you verified the blood with the second RN, then you want to get the patient vitals. You want to make sure that if they do have a fever, you call that doctor to see if it's okay to still give the blood. You definitely want to give them the Tylenol that's pre-ordered for the pre-medication, but you also let the doctor know. At that time, he might order something else to give in addition to that. Sometimes they give like a steroid or something like that if they suspect the reaction or whatever. What? If the patient If the patient is very tacky, or if the patient has CHF, and you giving this extra fluid, that can be something that that you have to be careful with. Watch out for not running too fast. So those are things that are important as well. But definitely checking the vitals. So another thing is, so you check the vitals are stable, you feel like you can go ahead and proceed with the transfusion. All right, so next thing you want to do is stay with the patient for the first 15 minutes. Stay with them for 15 minutes, because at this time you're watching them to see, do they have any new red spots popping up on them, hives. You want to watch out for hives. Is the patient itching, uncontrollably itching? Is the patient breathing fast, showing signs of distress, things of that nature? If the patient is like they having some type of anaphylactic reaction, you definitely, first thing you want to do is stop that infusion, flush the patient out, and return that blood back to the blood bank. Of course, this is me telling you this stuff, but always make sure you verify with your facilities. Policies and procedures. So after you stay with this patient, there's no reaction. You stay with them for 15 minutes. When that 15-minute mark hit, you recheck that vital again. So after 15 minutes of staying with the patient, before you leave that room, you recheck the vitals, and you just want to look and see, if the patient has all of a sudden became febrile, all of a sudden became tacky, those things, okay? So then after that, when the infusion is complete, you want to give it between a 2 to 4 hour window. You don't want to drag it out past 4 hours, because then the blood is no longer useful. Like, you're not supposed to use it after 4 hours. You don't want to run it too fast unless you're giving it in case of an emergency, if you're having like a massive transfusion going on or whatever. But just usually I give it between 2 to 4 hours. Now, another thing I must state, when I give y'all information regarding my knowledge pertaining to my patients, keep in mind that I work with adults. My facility, we don't see kids. If you're over 21, we see you. So a lot of this might be different if you dealing with kids. I don't deal with kids. I don't work with kids. And so all of this is basically referencing dealing with adults.
Sorry.
Okay, baby, don't pull my hair. Not right now. Wait, okay? We're going to wait a minute, okay? So now the next thing is, after you stay with the patient and you stay with the patient, you check the vitals after 15 minutes. Then after the blood is complete, the patient is stable, you do the end of transfusion vital signs. You do the end of transfusion vital signs, and then that's it. And then just make sure you have all your proper documentation and all of that stuff is complete. So there it is. So always remember, like I said, always check with your facility policies and procedures, just to make sure you are doing it according to theirs. This is just a ballpark of information of what I do in my facility. So hopefully this will be helpful to you. As always, if you're new to my channel, please subscribe. And if you've been with me and you still rock with me, more power to you. All right. But anyways, I'll see y'all in the next one. Bye.